You're about to discover the warning signs that could save your life, or the life of someone you love. What you're about to learn will change how you think about those little symptoms you've been brushing off as just getting older. This isn't another lecture about eating your vegetables or walking more. This is about recognizing when your body is sending you an SOS signal, and why the symptoms you think are normal aging might actually be your brain screaming for help. Sarah Mitchell, 58, administrative manager from Ohio, thought she was just having a stressful morning. She'd been tired lately, had some headaches. Words occasionally got jumbled when she talked fast. Nothing major, just life at 58, right? Then while brushing her teeth on a Saturday morning, she looked in the mirror and saw something that made her blood run cold. The left side of her face wouldn't move. Every minute you wait to recognize these signs, millions of brain cells die. The symptoms Sarah ignored for weeks were actually her body's final warnings before a life-threatening stroke. Most people wait too long and pay the ultimate price. I'm Dr. Ellis Grant, family medicine physician with over 30 years treating stroke patients. Welcome to Health SOS, where real people share real warnings that could save your life. I've seen too many patients come through my doors saying exactly what Sarah said. I thought it was nothing. Sarah's about to tell you exactly what those nothing symptoms felt like and why ignoring them almost cost her everything. Sarah, before we talk about that Saturday morning when everything changed, I want to understand what your body was trying to tell you in the weeks leading up to your stroke. Take me back to those early signals.
You know, Doctor Grant, looking back now, I realized my body had been sending me warnings for about 6 weeks. But at the time, I had perfectly logical explanations for everything. I started needing 2 cups of coffee instead of 1 just to feel awake. By 2 p.m., I felt completely drained, like I'd run a marathon instead of sitting at a desk processing insurance claims.
What we call unusual fatigue that doesn't match your activity level, is often one of the first signals your brain sends when blood flow becomes compromised. Your brain is an energy-hungry organ, using about 20% of your body's total energy. When that supply gets disrupted, even slightly, exhaustion is often the first symptom.
I wish I'd known that then. I just kept telling myself, Sarah, you're 58. You work full-time. You're helping your mother with doctor appointments. Of course you're tired.
Tell me about the other symptoms you experienced.
The headache started about a month before my stroke. Not severe, just this persistent, dull ache that Tylenol couldn't quite touch. They felt different from my usual stress headaches, but I work in insurance, dealing with upset people all day. I figured it was just job stress.
Sarah, here's something that might surprise our viewers. About 80% of people who have strokes report having warning symptoms in the days or weeks beforehand, but less than half seek medical attention. The symptoms you're describing, unusual fatigue, persistent headaches that feel different, these aren't just inconveniences. They're your brain's emergency broadcast system.
Dr. Grant, can I ask you something that's been bothering me? Why don't these warning signs hurt more? I mean, if my brain was in trouble, shouldn't there have been pain that made me pay attention?
That's one of the most dangerous aspects of stroke warning signs. Your brain doesn't have pain receptors the way other organs do. So when blood flow gets compromised, you lose function gradually. Energy, clear thinking, coordination, but without the sharp pain that would send you running to the emergency room.
That explains so much, because there were other things too. Sometimes at work, I'd mix up simple words when talking to clients. I'd say Thursday when I meant Tuesday, or call someone by the wrong name when I was looking right at their file. But I just thought I was talking too fast, trying to multitask.
What you were experiencing were likely transient ischemic attacks, TIAs. Think of them as your brain's warning shots. Brief episodes where blood flow to part of your brain gets temporarily blocked, causing symptoms that may last minutes or hours, then seem to disappear.
You mean I was having mini strokes and didn't know it?
Exactly. And here's what I want everyone watching to understand. TIAs are often called warning strokes because they predict a major stroke. About 1/3 of people who have TIAs will go on to have a stroke, often within days or weeks. But here's the crucial part. TIAs are treatable when caught early.
What should I have done differently? What should people watching this do if they're having symptoms like mine?
Any persistent change in how you feel or function deserves medical attention. Unusual fatigue lasting more than a few days, headaches that feel different from your normal patterns, any changes in speech or word finding, brief episodes of weakness or confusion, these warrant a doctor's visit, not a wait-and-see approach.
I kept thinking I'd feel foolish going to the doctor for being tired or having a headache, but feeling foolish is better than what almost happened to me.
Sarah, what you didn't know then, but what viewers will learn today, is that there's a simple 30-second daily test you can do at home to check for stroke warning signs. We'll show you exactly how to do it before this conversation ends.
I do that test every morning now. It's become as routine as brushing my teeth.
But first, I need you to take us to that Saturday morning, because what happened next wasn't just another warning sign you could explain away. It was your body's final, unmistakable call for help.
October 14th, the morning that changed everything. I was up early, planning to make potato salad for our office potluck. I felt tired like I had been for weeks, but nothing seemed different at first. Then I called my son Jake to tell him about Grandma's appointment. I tried to say potato salad, but it came out as gibberish.
Sarah, that garbled speech episode you just described, that was likely another TIA, a mini stroke affecting the speech centers of your brain. When blood flow gets temporarily blocked to the areas that coordinate language and muscle movement, you get exactly that kind of symptom. What happened after you hung up with Jake?
About an hour later, I was in the bathroom getting ready, and that's when I saw it in the mirror. The left side of my mouth was drooping, just slightly, like I'd gotten Novocaine at the dentist.
Tell me exactly what you did when you noticed that.
I tried to smile. You know how you check your teeth in the mirror? Except when I smiled, only the right side of my mouth went up. The left side just stayed put. I touched my left cheek, and I could feel my hand touching it, but it felt distant, like my face was wrapped in plastic.
What was going through your mind at that moment?
Honestly, I splashed cold water on my face. I actually thought maybe I'd slept wrong. Maybe I had a pinched nerve. I spent about 10 minutes doing facial exercises, scrunching my face up, opening my mouth wide, trying to wake up the left side of my face like it had just fallen asleep.
Sarah, what you were seeing was your facial nerve losing its connection to your brain. When blood flow to the motor cortex gets disrupted, the muscles on the opposite side of your face lose their ability to respond normally. But instead of recognizing this as a medical emergency, you tried to fix it with cold water.
Dr. Grant, can I ask you something? When people see facial drooping like that, how quickly should they act? Because I wasted so much time trying to convince myself it was normal.
Facial drooping is part of what we call the FAST test. Face drooping, arm weakness, speech difficulty, time to call 911. Any one of these symptoms, even if it seems mild, requires immediate medical attention. The sooner treatment begins, the better the chances of preventing permanent damage.
I didn't call anyone right away. I actually needed to borrow mayonnaise from my neighbor, Mrs. Chen, for the potato salad. When she opened the door, she looked at me strangely and asked if I was feeling okay. She said I looked like I might be coming down with something.
A neighbor who saw you for 30 seconds recognized something was wrong, but you still didn't.
That's exactly right. I thanked her for the mayo and went back to my kitchen, determined to make that potato salad and prove to myself everything was fine. But when I tried to peel the potatoes, my left hand wasn't working right. I kept dropping the peeler. When I tried to hold a potato steady, my grip felt weak, like I was wearing a thick glove.
At what point did you finally acknowledge that something serious was happening?
When I tried to walk to the living room and couldn't walk straight, I was listing to the left, using the wall to guide me. That's when I got scared, really scared. I sat down on my couch and realized I might not be in control anymore.
Who did you call first?
Not 911. I called Jake. I tried to tell him what was happening, but my speech was so slurred he couldn't understand me. He kept saying, "Mom, slow down, I can't understand you." When he finally figured out what I was trying to say, he actually yelled at me, "Mom, hang up right now and call 911."
But you hesitated even then.
I did, because calling 911 meant admitting this was real. It meant ambulances and hospitals and becoming a patient instead of someone who takes care of other people. I sat there for maybe 2 more minutes, hoping everything would just go back to normal.
Those 2 minutes represent exactly why we need people to understand stroke symptoms. Every minute that passes without treatment, your brain loses approximately 1.9 million neurons. While you were hoping your symptoms would disappear, your brain cells were dying.
What finally got me to act was when I tried to dial 911 and couldn't remember which numbers to press. My brain knew I needed help, but I couldn't coordinate the thought with the action. I stared at my phone trying to remember. 911. Such simple numbers, but it was like trying to recall a phone number from childhood.
That's when Mrs. Chen came back.
She'd been worried about me and decided to check. When I tried to tell her I was okay, I couldn't get the words out. She took one look at me and said, "Honey, I'm calling an ambulance." She probably saved my life.
The paramedics arrived within 7 minutes and immediately performed the FAST test. By then, you couldn't lift your left arm, and you were drooling without realizing it. What you didn't know at that moment was that your brain scans would reveal something that explained everything. Not just what was happening that morning, but what had been building for weeks.
Dr. Grant, when I got to the hospital and they did those scans, that's when everything started to make sense, wasn't it?
Tell me what the doctors found when they looked at your brain images.
The neurologist showed me the scan and explained that I'd had what they call a significant ischemic stroke. But then he said something that made my stomach drop. He could see evidence of smaller, older damage, places where I'd had many strokes before.
So those warning symptoms you'd been experiencing, the fatigue, the headaches, the word mix-ups, weren't separate problems. They were all connected, all pieces of the same puzzle.
Exactly. Dr. Grant, I need to ask you something that's been bothering me ever since. How long had this been building up? Could I have prevented the big stroke if I'd paid attention to those earlier symptoms?
That's one of the most important questions in stroke medicine, Sarah. Ischemic strokes like yours happen when a blood clot blocks an artery leading to the brain, but that clot doesn't usually form overnight. Often there's a process of narrowing arteries, small clots that come and go, and yes, those TIAs you experienced. About 1/3 of people who have TIAs will go on to have a major stroke, often within the first few days or weeks.
So my body was literally screaming at me for help, and I kept telling it to shut up and tough it out.
The challenging part about TIAs is that they're designed to be temporary. Blood flow gets blocked briefly, you have symptoms, then blood flow resumes, and the symptoms disappear. That's exactly what makes them so dangerous. People dismiss them because they seem to resolve on their own.
What exactly was happening in my brain during those weeks when I was having headaches and feeling tired?
Think of your brain's blood supply like a highway system. When traffic flows smoothly, everything works perfectly. But when there are partial blockages, like construction zones, traffic slows down. Some areas don't get the resources they need efficiently. That's what causes the fatigue and cognitive changes. Your brain was working harder to do the same task because it wasn't getting optimal blood flow.
And the headaches?
Headaches in the context of cerebrovascular disease often result from your blood vessels trying to compensate. When some arteries are narrowed, others have to work harder, dilating to increase blood flow. That vascular stress can trigger headaches that feel different from your typical tension headaches.
Dr. Grant, I want to understand the risk factors. The doctors talked about my blood pressure, my cholesterol. I thought I was relatively healthy for 58. What should I have known about my stroke risk?
This is crucial information for everyone watching. Stroke risk increases significantly after age 55, with risk roughly doubling every decade. High blood pressure is the single most controllable risk factor. It contributes to about 80% of strokes. Even mildly elevated blood pressure, what we call prehypertension, increases your risk. High cholesterol, diabetes, smoking, and a sedentary lifestyle all compound that risk.
I hadn't had a physical in over 2 years. I kept meaning to, but I felt fine. I was busy, and honestly, I didn't want to take time off work for something that seemed unnecessary.
Sarah, that's exactly the disconnect we see repeatedly. People understand risk management in other areas of their lives. They maintain their cars, inspect their homes, plan their finances. But somehow we've normalized neglecting the one thing we can't replace: our health.
Looking back, were there specific warning signs I should have recognized as stroke-related rather than just normal aging or stress?
Any persistent change in how you feel or function, especially after age 55, warrants medical evaluation. Unusual fatigue lasting more than a week, headaches that feel different from your normal pattern, any speech changes, even if they seem minor, brief episodes of weakness or numbness, changes in vision, or balance problems. The key word is persistent, symptoms that keep recurring or gradually worsen.
What about family history? Should my sons be worried?
Family history does increase risk, but it's not destiny. Having a parent who had a stroke increases your children's risk by about 30%. But here's the important point. Most stroke risk factors are controllable through lifestyle and medical management. Your sons should know their numbers: blood pressure, cholesterol, blood sugar. They should have regular checkups and maintain healthy lifestyles.
The doctors also mentioned something about the type of stroke I had. Can you explain the difference between the types?
There are two main types of stroke. Ischemic strokes, like yours, account for about 87% of all strokes and are caused by blood clots blocking arteries to the brain. Hemorrhagic strokes are caused by bleeding in the brain when a blood vessel ruptures. Both are medical emergencies, but the treatments are very different, which is why rapid diagnosis in the emergency room is so critical.
How close was I to not making it? Because lying in that hospital bed, I kept thinking about my sons having to deal with losing their mother because I was too stubborn to listen to my body.
Sarah, the fact that you received treatment within hours rather than days made an enormous difference. In stroke care, we have a saying, time is brain. Every minute that passes without treatment, approximately 1.9 million brain cells die. Your neighbor Mrs. Chen and your son Jake's insistence that you get immediate help likely saved not just your life, but your independence.
That brings me to something I really want people to understand. What I learned in that hospital wasn't just about what went wrong. It was about what I needed to do differently going forward.
Sarah, tell me about that transformation. How did you go from someone who ignored warning signs to someone who became an expert at listening to her body?
It started in that hospital bed when I realized I almost left my sons without a mother because I was too stubborn to pay attention to symptoms. I had to completely rewire how I thought about self-care. Before my stroke, I thought taking care of myself was selfish, that it took time away from people who needed me. Now I understand that not taking care of myself was the selfish thing.
What specific warning signs should people be watching for that you wish you'd understood earlier?
That's exactly what I want to know, Dr. Grant. What should people our age be looking for that might seem like normal aging but actually isn't?
Let's break this down systematically. First, unusual fatigue. Fatigue that doesn't match your activity level or doesn't improve with rest. Your brain uses about 20% of your body's energy. So when blood flow is compromised, fatigue is often the first signal. If you're sleeping well but still feeling exhausted for more than a week, that needs evaluation.
What about headaches? Because mine felt different, but I kept attributing them to stress.
Headaches that represent stroke warning signs typically have distinct characteristics. They're often more persistent than your usual headaches, may occur at unusual times like waking you from sleep, and importantly, They feel qualitatively different from your normal headache pattern. When blood vessels in the brain are under stress from reduced flow or elevated pressure, the resulting headaches often don't respond well to over-the-counter medications.
And speech changes? Because I had those word mix-ups for weeks.
Speech and language changes are among the most important warning signs. This includes difficulty finding words, mixing up simple words you know well, slurred speech that comes and goes, or trouble understanding what others are saying. These symptoms occur because language centers in the brain are particularly sensitive to reduced blood flow. Even brief episodes that seem to resolve completely should prompt immediate medical evaluation.
Dr. Grant, how do we tell the difference between normal forgetfulness that comes with aging and something that might be stroke-related?
Normal aging might involve occasionally forgetting where you put your keys. Stroke-related cognitive changes involve forgetting what keys are for. Normal aging is forgetting a name you know well. Stroke-related changes are difficulty understanding familiar concepts or following simple instructions. The key distinction is whether the changes interfere with your ability to function normally in daily activities.
What about physical symptoms? I had weakness in my hand that I explained away.
Physical warning signs include sudden or gradually worsening weakness on one side of the body, numbness or tingling that doesn't have an obvious cause like sleeping on your arm, changes in coordination or balance, and vision changes. These might include double vision, visual field cuts where you lose peripheral vision, or sudden vision loss. Any of these symptoms, even if they seem minor or intermittent, require immediate medical attention.
How should people monitor their stroke risk factors? Because I hadn't had my blood pressure checked in years.
This is where prevention becomes very practical and manageable. Every adult over 40 should know their 4 critical numbers: blood pressure, cholesterol levels, blood sugar, and body mass index. Blood pressure should be checked at least annually, more frequently if it's elevated. Normal blood pressure is less than 120/80. Cholesterol should be checked every 5 years if normal, more often if elevated. Blood sugar screening should begin at age 45 and be repeated every 3 years.
What constitutes high blood pressure that increases stroke risk?
We classify blood pressure as follows. Normal is less than 120/80. Elevated is 120 to 129 systolic with less than 80 diastolic. Stage 1 hypertension is 130 to 139/80 to 89. And stage 2 is 140/90 or higher. Here's the crucial point. Even blood pressure in the 130/80 significantly increases stroke risk compared to optimal levels below 120/80. Many people think 140/90 is when they need to worry, but damage begins much earlier.
What about lifestyle factors? What changes make the biggest difference in preventing stroke?
The most impactful lifestyle modifications are, in order of importance, controlling blood pressure through diet, exercise, and medication if needed, not smoking or quitting if you smoke, maintaining a healthy weight, exercising regularly, at least 150 minutes of moderate activity weekly, eating a diet rich in fruits, vegetables, and whole grains while limiting sodium, limiting alcohol consumption, and managing stress effectively.
Dr. Grant, can you explain what people should do if they think they're having stroke symptoms? Because I wasted so much time trying to convince myself everything was fine.
This is absolutely critical. Use the FAST test, FACE. Ask the person to smile. Look for facial drooping. Arms. Ask them to raise both arms. See if one drifts down. Speech. Ask them to repeat a simple phrase. Listen for slurred or garbled speech. Time. If any of these signs are present, call 911 immediately. Don't drive to the hospital. Don't wait to see if symptoms improve. Don't call your doctor first. Call 911.
What about TIAs specifically? If symptoms come and go?
TIAs are medical emergencies even if symptoms resolve completely. Think of them as your final warning before a major stroke. If you have any symptoms consistent with stroke that resolve within 24 hours, you've likely had a TIA and need immediate emergency evaluation. Don't be reassured by the fact that you feel better. That's exactly what makes TIAs so dangerous.
How do we get family members involved in recognizing these signs?
Family education is crucial because stroke symptoms can impair a person's ability to recognize their own condition. Teach family members the FAST test. Make sure they understand that even mild symptoms require emergency response. And establish a family emergency plan that includes knowing which hospital in your area has stroke treatment capabilities.
All of this knowledge feels overwhelming, but I realize now that ignorance almost cost me everything. The question is, how do we turn this knowledge into daily habits that actually protect us?
Sarah, that's exactly what I want to focus on. Transforming knowledge into sustainable daily practices. Show me what your new routine looks like now, 8 months after your stroke.
Every morning, the first thing I do after I get up is what I call my health check-in. I do a 30-second test that has become as automatic as brushing my teeth. I look in the mirror and smile to check for facial symmetry. I raise both arms to make sure they move equally, and I say a tongue twister out loud to check my speech.
That's your personal daily FAST test. Can you walk our viewers through exactly how to do this at home?
Absolutely. Stand in front of a mirror and smile widely. Both sides of your mouth should move up equally. Then raise both arms over your head and hold for 10 seconds. They should stay level. Neither arm should drift down. Finally, say something like, "The early bird catches the worm," clearly out loud. Your speech should be clear and easy to understand.
How often should people do this self-assessment?
I do it every morning, but Dr. Grant, what would you recommend for people who haven't had a stroke?
For anyone over 55, especially those with risk factors like high blood pressure or family history, I recommend a daily 30-second check. For those with lower risk, weekly is reasonable. The key is consistency. Make it a habit so you'll notice any changes immediately.
I also check my blood pressure every morning now. I have a simple home monitor, and I track the numbers in an app on my phone. My target is less than 130/80, and if it's elevated for 3 days in a row, I call my doctor.
That's excellent blood pressure management. For viewers who don't currently monitor their blood pressure at home, what should they look for in a home monitor?
Dr. Grant, that's something I had to learn. What makes a good home blood pressure monitor?
Look for a monitor validated by the American Heart Association with an appropriately sized cuff for your arm. Take measurements at the same time each day, ideally in the morning before medications. Sit quietly for 5 minutes before measuring. Keep your feet flat on the floor and support your arm at heart level. Take 2 readings 1 minute apart and average them.
The medication routine was another big change. I take my blood pressure medication and blood thinner at exactly the same time every morning with breakfast. I use a pill organizer with day-of-the-week compartments, and I set a phone reminder. Missing doses isn't an option anymore.
Medication compliance is crucial for stroke prevention. Sarah, how do you handle the practical aspects of living with stroke risk?
I had to reorganize my whole approach to healthcare. I see my primary care doctor every 3 months instead of avoiding checkups altogether. I have a cardiologist and a neurologist now, and I actually keep a health journal where I track symptoms, blood pressure readings, and how I'm feeling day to day.
What should people include in a health tracking system?
I track my blood pressure, any headaches and their intensity, energy levels, sleep quality, and any unusual symptoms, no matter how minor they seem. If I have 3 days of anything that feels off, I call my doctor. I also track my exercise. I walk for 30 minutes every day now, and I log it.
Family involvement is also critical. How have you educated your family about stroke recognition and prevention?
I taught both my sons the FAST test, and we actually practice it when they visit. They know my target blood pressure numbers. They know my medications. And most importantly, they know that if I ever downplay symptoms or say, "I'm fine," they have permission to override me and call 911.
That's excellent family emergency planning. What other practical preparations should people make?
Know which hospital in your area has stroke treatment capabilities. Not all hospitals can handle strokes effectively. Keep a list of your medications and medical conditions in your wallet and on your phone. Make sure family members know where this information is kept.
Sarah, for someone watching this who recognizes themselves in your pre-stroke story, someone who's been ignoring symptoms or putting off medical care, what's the most important first step they can take today?
Schedule a physical with your doctor this week. Not next month, this week. Ask for a comprehensive metabolic panel that includes blood pressure, cholesterol, and blood sugar testing. Be honest about any symptoms you've been explaining away, and start doing the daily FAST test tomorrow morning.
What's your message to family members who are worried about a loved one who might be ignoring warning signs?
Don't enable their denial. If you see facial drooping, slurred speech, weakness, or confusion, call 911 even if they object. I'm alive today because my neighbor Mrs. Chen and my son Jake refused to let me minimize what was happening. Sometimes loving someone means overriding their stubborn independence.
Sarah, if you could go back and tell your pre-stroke self one thing, what would it be?
Your body loves you. Every symptom, every moment when something feels off, that's your body trying to protect you. It's not trying to inconvenience you or slow you down. It's trying to save your life. Listen to it before it has to scream at you the way mine did.
The daily habits Sarah has described, the 30-second fast test, blood pressure monitoring, medication compliance, regular medical care, and family emergency planning, these aren't complicated or time-consuming, but they can mean the difference between recognizing a problem early and facing a life-threatening emergency. Your body has been with you through everything. It deserves your attention, your respect, and your daily care.
If my story helps even one person pay attention to their warning signs instead of explaining them away, then everything I went through was worth it.